Today, it's my pleasure to talk with University of Minnesota President and Greater MSP Board Member Joan Gabel. The university is one of the greatest economic assets we have in the state and the region, and we're reminded of that in the current health and economic crisis we're facing. The university has been at the center of COVID-19 as an educational institution, a healthcare provider, and a source of innovative solutions. And we're going to try to cover all that ground in our short conversation today. So welcome, President Gabel.
Thank you. I'm very glad to be here.
Let's start with innovation. So innovation is a value of the Greater MSP Partnership because it's an essential capability. And the current crisis makes clear why innovation is so critical. It's how we respond and adapt to real problems. And the university has been on the front lines of the crisis, bringing everything in its innovation toolkit. And the result has likely been lives saved already. President Gabel, could you share a few of those kind of early innovation victories with us?
Sure, and I think it is really nice that we have some good news, because a lot of what we hear these days is dire, and there is good news. And some of it comes directly from the university. A lot of it comes from the university in partnership with many of you, or in partnership with other universities, or as a result of the creative ingenuity of our people. And that's how we've always been, but it is something that we think we've been in a unique position to offer service towards, and over time, and certainly right now is no exception. So I think some of the things that have been most obvious is, as we record this, the governor has just announced a partnership between the state, the university, and the Mayo clinics to ramp up testing, which we know is a cornerstone component of our entire state's economic recovery, and also in our own health and safety as individual citizens of the state. So being a partner to the development of the tests, how we deliver those tests both in the metro and around greater Minnesota, so that the citizens of the state are safe and healthy and have good information, employers can make good decisions, and then collectively we recover. So that's cornerstone. We also heard a few days ago from the FDA on an urgent approval of what we've been calling the CoVenter, which is the MacGyvered ventilator. I wish I could come up with those names, but isn't that great? But that's a collaboration between med school, engineering, several of our large industry partners, several of our startup industry partners, to create a rapid production, low-cost frontline ventilator that the bulk of which actually we will ship outside of Minnesota, because we're not in our surge and don't need, but then they could come back, or we could produce them if we need them. College of Design and College of Engineering have been working together to do rapid production of masks and other personal protective equipment. We have been doing drug tests, the kinds of things you would expect us to do. 3 different drugs that you've heard about on the news a lot around early exposure, testing positive with low symptoms, testing positive with high symptoms, and also some inhaled drugs to help with lung response. But there are 29 other drugs in proposal process to reach the point for testing. So we should be able to be a part of the good news story there. And then there's all the things that aren't directly related, but are so important. Business schools working on supply chain. In education faculty are working on how to bolster teachers. There's all of these unsung heroes on academic technology, mental health, a variety of things that as a community we feel, and that we as the university teach, research, serve, offer in different ways. And then I'll say, last but not least, we're a really big employer in the state. We don't really think of ourselves that way, but and I haven't seen the latest numbers, but we're certainly in the top 10 and often in the top 5 in terms of size of employer. And we made our values statement around how we're handling this, of course, health, safety, and well-being of our people first and foremost, but we are prioritizing retaining our employees, even if we have to do so through clever ways and some shared sacrifice, so that we protect our workforce, our biggest asset, and we're a cornerstone of a knowledge economy, but also because we think it's the right thing to do, so that we are a part of an economic solution and people keep their health benefits during this time rather than the alternative.
Well, that is good news across the board, and a reminder of the breadth of the enterprise that is the university. And some of those stories are now being told about the MacGyvered ventilator, and it will work to amplify those because the university is part of a really exciting Minnesota story that involves the Mayo Clinic and 3M and so many, and Medtronic and so many others. We want the world to know that we're producing global solutions here.
Yes.
The university is a major health system. You have a major strategic partnership with Fairview, and health systems are under enormous pressure due to many factors, including the suspension of elective surgeries and other non-COVID related care. How is mHealth coping with the crisis?
So just for everybody's, just to level the playing field, so mHealth Fairview, you see all the signage now throughout the state, represents a partnership between the University of Minnesota Medical School and Fairview Health System. And mHealth Fairview is the hospital, and then the doctors, UMP, are part of the university and the medical school, and it's a very complicated relationship, an excellent relationship, and we call it's a marriage. And a few years ago we redid the contract, and I've called it renewing our vows, and I'll say that again. And we're happily married and celebrating our anniversaries and all of that good stuff. Wish we could do it together in person, but health delivery is exceptionally challenged now nationally, and we are not immune to that. The expense in terms of the demand on the frontline workers is enormous, and of course we're exceptionally grateful to them. The work that they're doing is not able to currently be offered as of today, with other things that we would normally do that are a very big part of how we deliver care, but also how we generate revenue for the health system. And there are a lot of things that it may be a little while before we do. So if you think of it in tranches, there's the COVID-19 work and the sickness and care that requires. And then there's things like broken bones and cancer and things that happen anyway, and the delays that have happened there that happen all the time. And then there's truly elective things that can truly wait. And there are doctors not working right now, and there are services not being provided, and that's part of a business model that is disrupted right now. So Jacob Tolar, who of course is our Vice President for Clinical Affairs and Med School Dean, presented to our board at the time we're shooting this 2 days ago, so just a few days ago from the time everybody sees this, on how we want to defer some of the contractual obligations that go back and forth so that we can confidently maintain the highest quality care. We have no choice but to do that. And then as soon as is safe, start to restart the engines on the other types of care, that mid-level group I described, until we're ultimately back in elective. The good news is we came into this as a partnership in a strong financial position, and with a relationship that created some shared good news when we have it, and some shared stability to endure difficult news that we're in right now. And so we feel a lot of confidence about the future, but we have to tighten our belts in the meantime.
Now, again, at the time that we're having this conversation, the Congress is taking another action. It looks like there is some national support for hospitals, national hospitals. Do we know what that's going to mean for the university or other hospitals in our region yet?
I don't know what that means for our hospital. I do know that the last tranche of federal stimulus funds included higher ed funds, some of which will include support for our health sciences broadly. But I don't know exactly what the latest bill will do for hospitals, but hopefully it will be a lot. That would be my wish.
Yeah. Well, speaking of the other businesses of the university, so you are a major degree granting institution. And that model has been upended in ways we've been reading about. And you and your team have had to make really hard and unprecedented decisions about graduation and summer session, maybe next fall. I think we're tracking those things in the press, but I wonder about looking a little bit further ahead, where higher education is concerned. Do you think that this crisis has already changed higher education in ways that will be enduring? And how do you think the university may educate students differently in the years to come?
So I'm going to steal a line from my colleague, Mike Osterholm, who is the head of our infectious disease center, and everyone has seen him on the news with frequency lately, where he says there are new normals like flying after 9/11 is fundamentally different than it was before, with security checks and, small vials of our liquids, but we still fly. Mm-hmm. And I would steal from that shamelessly to think about what higher ed is likely to look like after this. So there are some things that I think will be true across sectors, not just in higher ed. I think we'll have more openness to people working from home. We'll have more openness to a different definition of work-life balance, or what it means to communicate, and how we fill our free time. And, it's changed a lot of people's views on fitness and a variety of things that have changed our lives that have some real potential positive tails after all of this is done. I do think this will be a catalyzing change in people's openness to distributed delivery of information in a variety of ways, including classroom information. And so some types of classes or some types of programs that could have never been online before, I think we may be significantly more open to seeing that they could be delivered online. But I attended a talk years ago when I was a dean of business. This was more than 10 years ago, by somebody at one of our conferences. I can't even remember the details of the conference, but the speaker was an expert on disruption. And she talked about higher ed and its capacity for disruption. And she described its capacity for disruption as high. But she said, typical reasons, high bureaucracy, barriers to entry, the kinds of things we talk about in an entrepreneurial ecosystem all the time. But she also said there are unique attributes that cannot be replaced easily during disruption, like the network, the life experience, the organizational identity, the credibility and legitimacy of having earned grades and a degree. And we've seen inroads into those things over time, certificates and different types of online programs, and some very legitimate peer institutions delivering entire programs online. And we do that too. We did that before, and we'll do that more so. But there are some things that are unique to the on-campus experience. So what I see going forward is more online, different online, probably a little less rigidity around September to December, August to December, January to May, but complete destruction of the on-campus experience, I don't see that.
Because football can't be online.
I mean, exactly. At the end of the day, like football, and hockey and basketball and volleyball and everything else. I don't want to leave any sports out.
That's right. That's right. All the sports.
Exactly.
All the teams. Well, I mean, regardless of where we graduated from, we all have some maroon or gold in our closet. And, we're on the university's team pulling for you in this difficult time, acknowledging the importance of the university in our state, in our region, our economy. What are a few specific things that leaders in this community, in this region and state, could do over the next few months to support the university's short and long-term success? What do you really need and from whom? And I would encourage you to name names.
Okay. I made a list in anticipation of this question. So I think it's very important, first and foremost, to remember our students. We still want them to get a job. We still want them to have an internship. You need them. Even if you don't need them exactly today, you need them really soon, and keep them in mind as the new talent enters the workforce anyway, even if it's in this unusual way, that as we recover, we want all of that age group to be employed. So even if it's a stretch right now, we hope you will employ and allow to intern this generation of students. I think it's important to remember that the university is a big part of the economy in the ways that we've discussed. And so as you're visiting with legislators and they're asking you what your needs are, to keep us in mind as, and not just assume that we're capable of continuing at the level we've been in service without the support of the state or without your support in the different ways in which we partner. Philanthropic support is always appreciated, arguably now more than ever. And so we would always be grateful for that kind of support. And then I think the last thing is that we've created a hashtag on social media, hashtag UMNProud. And because we all have maroon and gold in our closet, and I love that about this state, that you can be adopted. member of the University of Minnesota family, really open arms. Take a peek. If there's good news that you think we haven't shared or that you don't see on our website or through social media, tell us, because we want to be a convener and amplifier of things getting better in all of the ways we've described. And sometimes we're in a unique position to push that content out. So let us know if there's something you'd like us to share.
Well, we're going to share that hashtag, and we'll make sure everybody gets that list. You hadn't had a lot of months in role before this all hit. And I'm wondering if there are any leadership lessons you're taking from this crisis so far, things that you're going to do differently going forward because you've had this experience.
Yeah, I'm removing the word unprecedented from my vocabulary. I think that
Sorry.
we would have used, I think we've used that word. It is the most accurate word to describe everything that's going on, but that will be my first lesson, is to use it until I don't need to anymore, and then I'm throwing it away. But our communication style has changed. And I think that one of the enduring lessons of this is how important it is to remember who might not know what's going on at any given time. And our communication tree is always one of our biggest challenges. I mean, we have 5 campuses. We have 67,000 students across all 5 campuses, 27,000 employees at any given time. And you say something and it's picked up by the media or it's picked up by social media, and so you assume everyone knows. And now we know that's not the case. And so we've gone back a bit old school in some of our communication styles of really sending a lot of email, things that everybody gets, even if they don't open it. Just the lessons of having a flat communication tree, rather than assuming that by telling a small group of people, everyone is eventually hearing it in a timely and accurate way. So a lot of communications lessons around that. And the other side of that coin are leadership lessons. And the other side of that coin is remembering, because of this communication style, we're being reminded that some of our best solutions come from the bottom up. And of course, you know that, but your capacity to receive it, the ease with which those people can bring those ideas to you, you forget, if you don't have it in front of you all the time, how hard that can be to be heard. And so making sure that you keep those channels open is an excellent reminder, and something that we intend to be purposeful about after this. And then the other thing that I think is really critically important that we're very reminded of is that this is unprecedented, but it is not a one-off. I mean, we will have crises again. So how do we prepare across the enterprise with good enterprise risk management, good proactive planning to be ready, so that the next thing is something that we can handle, so that we can fulfill all of our mission in the ways we've discussed previously. So really good communication, really good thought around the complexity of your people, and open lines of communication to those people, and good risk management.
Well, that all resonates with me, and some of those are themes that I'm hearing from others as well. And to your point about communication, I mean, that's exactly why we're having this interaction and trying to share it out, because we know in a moment like this that the gaps between sectors, the gaps between levels, the gaps across the region, they open up. Mm-hmm. And it's that much harder, and it takes that much more effort to proactively bridge those gaps. Maybe just finally, because you have a university to go and run, what gives you hope? We're not at the bottom of this thing yet. The next couple of weeks are probably going to get even a little tougher, and so we're out there mining for hope. So what are you thinking about?
Well, I mean, at the risk of sort of Pollyanna table for one over here, but I feel a lot of optimism, because here's what I see. Even arguably sometimes being in an ivory tower that I don't always know that I'm in, and the risk of that, and as a new member of this community on campus, but also in the state, what I see are people pulling together. What I see is people spinning literally on a dime to do whatever it takes so that people are safe, so that the work gets done, so that the solutions are found. I see people, I look out my window, are outside walking and jogging and exercising and taking care of themselves. And so what I see is creativity and community, and a belief in the power of shared solutions that make us all better. And so, people can spiral out during downtimes like this. You can look at other crises that communities have seen. And where I lived before, we went through some really terrible weather events. Those were the closest thing to this kind of crisis that I had experienced in a leadership position. And people became scrappy immediately in many cases. I don't see that here. What I see is everybody pulling together even more closely despite the lack of physical proximity. And that makes me think that we will emerge stronger. And I know that's an adage and it can be a platform speech, but if you think about who you want to be as a community, that we get better together, that we look out for each other, that's how things actually improve. That's how we earn more. That's how we live better. That's how we're healthier. That's how we serve better. This would be the biggest test of that. And what I see is us passing that test with flying colors.
Well, love that spirit. We're so glad you're on Team Minnesota.
Thank you. Me too.
That's what we do here. And we are going to come out of this stronger with the university and everybody else. Thanks for everything you're doing.
Thank you.
We're going to surround you with support, and Sky Yuma.
Sky Yuma. Thank you.
All right. Thank you, President Gabel.